Hi, Torey Eisenman with Benchmark Real Estate Group, and we have Angie DiMura with AMD Care Management with us today. And you do some amazing things with families, and and I've lost both of my parents, but in that process, I felt very overwhelmed with a lot of things that we had to experience. And my father had health issues, so he had a diabetes doctor, he had a heart doctor, probably 5 different physicians that he went to, and we felt like none of them really talk to each other.
Sure.
What's your role, and how can you help a family in that type of situation?
Sure. So I usually attend appointments with families.
Okay.
So I keep the updated list of medications because that can change quite often from specialist to specialist. And again, just like you said, they are not always aware each one is seeing.
Usually not.
No.
Has been my experience.
And sometimes an elder person just assumes all the doctors know what's going on together. They must talk to each other, and that's not the case. It's just very individualized treatment right now. So I make sure any recent test that whatever doctor we're going to next is aware of, so they're not duplicating services, because that can happen. How many times do they need to get lab work done when maybe they just had it done last week, or another MRI when the doctor could just pull the one from a couple weeks ago if it's the same area. But so I try to help reduce the duplication of services and to keep the communication open for the physicians as well, and that way the individual is not feeling like a guinea pig. Again, I have to do this.
That reduces a lot of stress because, I've watched people and they get nervous.
Sure.
Right? They're very nervous about the process and not as trusting as to,
Correct.
How do you build that relationship with the family member?
Yeah, I have to, and that's very much in the beginning. I take time to get to know them and understand what their wishes are, and help be that voice at the doctors, because that's the other issue. Sometimes we go to the doctor and they're tired of going to a doctor.
Right.
They don't want to tell them anything else, because if I tell them the knee hurts, maybe I'm going to have more tests. So I try to keep the lines of communication open of what's really going on, and making sure they're following through so we're not coming back again and again and again.
Well, and one of the other things that I saw quite often is they don't necessarily tell the truth. Because they're not following the recommendations of the physician. So how can you help with that without demoralizing the family member, but making sure that that physician's getting the correct information to protect them?
Right. So I try to keep, whatever the doctor sends home with them, I try to keep them on that plan very respectfully and help them in the planning process. So if you're ordered therapy 3 times a week, what works best for you? Do you need somebody to come in? Is it a home health situation we could get set up? Or are we looking to go to outpatient? And helping them be part of the process and really encouraging them. And what's the challenge is, at the end of the day, they do have the right to refuse. So it's helping them understand the risk and benefit of the treatment too. And while if you don't want to participate, this is what we're looking at.
Which I think is so important, because when you're kind of demanded to do certain things, it becomes frustrating. You're already feeling like you're losing your capacities to what you were able to do before. So having that respect level is so important, and communicating with those physicians. And medications. I mean, I watch even people in their 50s, right? They don't know what they're taking and not communicating properly. And when you start getting a lot of different things, it's hard to track all that.
It very much is. So I try to keep an updated list for each client of mine of the current list of medications. And there's different systems we can put in place in the home as well to ensure they're taking them properly.
Okay.
So there's different medication management systems in place, as well as, you always start off as the least restrictive. If they're doing okay and they just need it organized in a pill box, and you monitor that that's being taken, that's great. But as maybe a little more cognitive impairment comes into play, there's medication systems, automated systems that will prompt them with voice commands to take them, and they have to press a button and it dispenses. And if they don't, then I get a phone call.
Oh, that's amazing. I didn't know that existed.
Absolutely.
Wow. So if somebody wants to reach out to you, a family member, even if they just want to be guided somewhat, how do they contact you?
They can reach me at 352-432-2115, or you can look up my website at amdcares.com.
Awesome. Thank you so much for your time.